Welcome to my YouTube channel. I am Olivia and I will be guiding you or assisting you in being prepared for your NCLEX exam. So this series is entitled Journey to the NCLEX exam. With that being said, let me just say I don't own any rights to any music being played in the background, or I do not have any secret connection with any organization where questions is concerned. It's all based on my personal experience and research. So with that being said, we all would like to take the NCLEX and pass it on our first try. It is not the same for everyone. We all have different challenges. Some persons have more than one job, family responsibilities, everything, just compiling, and the time that is available for studies may be limited. But I would like to share my approach and hope that it helps someone, right? So let me begin by saying this. The way we are accustomed to answering questions, let's just blank that out of our mind and focus, change our focus or train of thoughts to answering questions as if we were dealing with a real patient. It is no longer required to memorize the definition of anything or have the lab values written and imprinted behind our head. On the questions, you will have normal ranges and everything that is needed on your question. What we need to focus on is the cause of abnormal lab values, possible complications that can arise from the lab values being either too high or too low. We are going to take the exam as if we are dealing with a patient, and safety is important for the patient and for you as a nurse. What we are going to deal with first is a few simple basic questions to assess yourself to see how well you do on these questions. You can pause the video and attempt to answer it yourself before I give the answer. Do remember to like and subscribe to this channel so that you will be up to date when new videos are uploaded. Okay, so the first question. A client with renal failure is prescribed a low potassium diet. Which food choice would be best for this client? A, 1 cup of beef broth. B, 1 baked potato with skin. C, half cup raisins. Or D, 1 cup rice. Take a few minutes to answer the question and then go ahead. So if you would have selected 1 cup rice, you are correct. Now when we look at this question, it asks for the diet with low potassium. I don't know if you would have noticed that all of these diet listed here, food items listed, they all contain potassium, but they ask for the one that has the lowest or low potassium. And out of the list, the cup of rice had the lowest. Now beef broth, beef contains like 270 grams of potassium, right? Potato is known to be the food choice with the highest amount of potassium inside it. It has 620 milligrams of potassium. Raisins, this come in second, right, with 322 milligrams of potassium, while the rice just have 55 grams So here we see that rice is the correct answer. Now, another tip is that when you finish answering a question, go over your answers so that if another question arises with similar information, you'll be able to answer it. For example, this question asks for the food with the lowest potassium level. If you did your research or check back your answer, you know that potato has the highest amount of potassium in it. So if another question come about asking which food is best served for a person who needs a lot of potassium, if you see potato there, you know that potato has the highest amount of potassium. So you would readily think or click and choose potato. So that is why it is important to go over your answers, right? All right, let's move on to the next question. An appropriate nursing intervention for a client with borderline personality disorder is A, observing the client for signs of depression and suicidal thinking. B, allowing the client to lead unit group sessions. C, restricting the client's activity to the assigned unit of care throughout hospitalization. D, allowing the client to select a primary caregiver. Take a few minutes to answer this question. If you would have already selected your answer, the correct answer is A, observing the client for signs of depression and suicidal thinking. So persons with borderline personality disorders, they have a high tendency to have suicidal thoughts and be depressed. And we should observe them for these signs. The following answers are the other answers where they said allow them to lead group session and pick B and D, allow them to pick caregivers. For persons with borderline disorders or personality, it is not advised to have them, take control of a therapeutic environment. Let's say, for example, in the facility where they're at, they're already having thoughts and displaying signs of suicidal thoughts and depression. So you don't want to transfer that atmosphere, transfer that sort of thinking to the other persons in the facility. That wouldn't be a healing or therapeutic environment. And the answer C, restricting them to a specific area for the entire hospitalization. That's not best advice. Persons after their depression level would have been assessed and known, the healthcare team would be able to plan that person's activity levels and things that they can do, or plan their care better, so you don't have to isolate them within a specific area once proper evaluation is done. So the answer is A, for a person with borderline disorder, personality disorder. You observe them for suicidal thoughts and thinking and depression. Good. So if you would have got that right, congratulations to you. The next question: which of the following is an expected finding in the assessment of a client with bulimia nervosa? A, extreme weight loss. B, presence of lanugo over the body. C, erosion of tooth enamel. D, muscle wasting. Take a few minutes to select your answer. If you would have selected your answer already and you selected C, erosion of the tooth enamel, you are correct. Right, so let's go through the answers and see why the others are not correct. So answer A, B, and D all are signs and symptoms of anorexia nervosa. Right, the only one that is not a part of anorexia nervosa is the erosion of tooth enamel. So you might notice questions that have similar, that is close, that has conditions that is close to one another. For example, like anorexia nervosa and bulimia nervosa. With the anorexia, it's, obsession of the weight, extreme exercise, extreme measures to lose weight. While the bulimia nervosa, right, persons tend to overeat and then take measures to vomit or get rid of their foods by purging, right? So with the vomiting and the stomach acid coming up, it causes erosion to the enamel of the teeth. So they may present with brittle brittle teeth. So if you would have got that one right, congratulations to you. The next question, assuming that all achieved normal cognitive and emotional development, which of the following children is at greatest risk for accidental poisoning? A, 1-year-old, B, 4-year-old, C, 8-year-old, D, 12-year-old. Take a moment to think about it, and if you had selected your answer, the answer is 4-year-old. Reason being, 4-year-old are well developed with their hands or dexterity, open stuff, they can walk, they're curious, and not only they are at risk for poisoning, but other stuff like drowning, accidents, etc. 4-year-old is at risk. Answer A is incorrect because a 1-year-old is not that fully developed with their dexterity or movement with their hands. They're now trying to walk, they're now trying to talk, and all of these things. So the 1-year-old is out, and there are two other answers. The 8 and 12-year-old, they are more aware of danger and they are less at risk. Let me just say, all age ranges are at risk for everything, but this question is asking who is most at risk, right? So it is the 4-year-old. If you would have gotten this right, congratulations. Moving on to the next question. The nurse is ready to begin an exam on a 9-month-old infant who is sitting quietly on his mother's lap. Which should the nurse do first? A, check the Babinski reflex. B, listen to the heart and lung sound. C, palpate the abdomen. D, check the tympanic membrane. So take a few minutes to answer this question. If you would have answered it already, the answer is B, listen to the heart and lung sound. So if you have a 9-month-old sitting quietly in the mother's lap, the first thing that you should do is try to get the heart sound and the lung sounds done. Because if you attempt to do the Babinski reflex, where you have to arch at the bottom of the foot, right, to check for the movements of the toes, or if you try to palpate the abdomen and the baby starts crying, it will be difficult to assess the lung sounds and the heart rate afterwards. So get the first easiest task out of the way, listening to the heart and the lung sounds. Okay, moving on to the next question. To correctly assess the oxygen saturation level of an adult client, the pulse oximeter should not be placed on the A, finger, B, earlobe, C, extremity with non-invasive blood pressure cuff, D, the nose. If you want to correctly assess the oxygen saturation of an adult, where you should not place the pulse oximeter. Take a minute to answer this question. Excuse me. So the answer is C, the extremity with a non-invasive blood pressure cuff. So if you put on a blood pressure cuff on a patient and you put a pulse oximeter there, the blood pressure cuff inflates and deflates. When it inflates, it blocks off circulation, right? So circulation to the extremity would be, compromised. So when you put on a pulse oximeter, the reading would be inconsistent. So you do not put it on the hand or on the side where there is a blood pressure cuff, right? You put it on the other hand. So do not put the pulse oximeter on the hand that has the blood pressure cuff. All right, and one more question for the self-evaluation. Right, so this question: the nurse is teaching a client regarding use of sodium warfarin. Which statement made by the client would require further teaching? A, I will have blood drawn every month. B, I will assess my skin for a rash. C, I take aspirin for headaches. D, I will use an electric razor to shave. So this question is asking which of the client's statement indicates that they need further teaching, meaning that they're taking warfarin sodium, which is an anticoagulant, right? It helps prevent clotting and so on, and help to promote blood flow. So which one of their statement is going to bring harm to them? The answer is I take aspirin for headaches. Now, when taking warfarin or anticoagulants or blood thinners, you should not take NSAIDs, which is non-steroidal anti-inflammatory drugs or over-the-counter drugs, because aspirin will increase the bleeding risk, right? Because they're already on the warfarin, and with the aspirin, it will be an added effect. So, there are more risks for bleeding. All the other options are good. Using electric shave, less risk of getting cut, assessing the skin, having blood drawn every month. Those are, things that they should do. But using aspirin while on warfarin is a no-no. So we should advise that they do not take NSAIDs while on warfarin. So that is the answer. So that has brought us to the end of this session. Do like and subscribe and follow for another edition of Journey to the NCLEX exam. Do rate yourself from the questions we did today to see how you did, and you would be better prepared and know how much more studying you have to do and the topics. And do remember to go over your answers when you're practicing your questions. Go over the answers.